So you guys all experienced the pandemic firsthand, and this next award recognizes someone who helped us navigate through those challenging times. The Mary K. Ousley Champion of Quality Award honors one individual who has changed the course of quality in long-term care and post-acute care profession. And with everything going on this year, this was obviously especially critical. So I added my personal notes here. I know of no other person in the history of our profession who has so generously contributed her time, her energy, her mind to your residents, to my residents, and to our profession. Mary is a legend. So please join me in welcoming co-chair of the ACA-NCAL Quality Cabinet and HCA past chair and namesake of this award, Mary Ousley.
Thank you, Phil. It is my great pleasure to present the 2021 Mary K. Ousley Champion of Quality Award to a woman who played a critical role in helping long-term care residents and staff through the COVID-19 pandemic, Dr. Nimalie Stone. Nimale serves as a senior advisor for long-term care partnership in the Prevention and Response branch of the Center for Disease Control Division of Healthcare Quality Promotion. For years prior to the pandemic, she has led the CDC team on developing strategies, resources, and guidance with infection control and outbreaks in nursing centers. Among many of her accomplishments, she was responsible for the course design and content development of the virtual CDC Nursing Center Infection Prevention Training Program released in March of 2019, which was key, as we all know, as providers focused on new infection prevention requirements of participation and better prepared all of us to navigate the ever-changing guidance and challenges of the pandemic. Nimale was also the lead author of the revised McGreer criteria, which is the standard criteria used to diagnose infections in nursing centers, and her work on the CDC's core element of elements of antibiotic stewardship was transformational for evidence-based practice in healthcare, and specifically in infection prevention and control programs in our settings. During the pandemic, she was instrumental in coordinating federal and state strike team activities in our nursing centers, providing ongoing and evolving guidance tailored for providers to respond to contain COVID-19 infections. Nimale is a medical epidemiologist, a board-certified infectious disease physician who has a research and clinical background in managing infections and antibiotic-resistant pathogens in post-acute and long-term care setting. She completed her internal medicine residency at Johns Hopkins University, followed by an infectious disease fellowship at Emory University. We are forever grateful for her support and her actions to help our residents, our patients, and our staff receive the much-needed help and resources. I want to take just a second of personal privilege here before I hand this award, just to say that I met Nimale a number of years ago at a CMS meeting, and we were there to discuss some of the issues that we were facing in post-acute and long-term care, especially in infections. I thought as I arrived that day I knew a lot about infection prevention and control, but listening to her, I knew how much I really had to learn. She has been a friend of our profession above and beyond anything that we could have ever asked. And again, as we come together this week to again be together and think through what we've been through, I know that we could not have made it without the many times that we reached out and said, Nimale, what do we do next? So I am so deeply, deeply honored and proud to present this award today to this year's recipient. Champion of Quality, Dr. Nimalie Stone. Nimale.
Thank you, Phil and Mary. What an incredible honor to receive this award from the person whose commitment to quality inspired its creation. And how wonderful to be here with all of you this week. I can't tell you how much I've enjoyed sitting in sessions, networking with colleagues, and just not being trapped in my study on a cell phone or a Zoom conference. I feel so optimistic and recharged by the past few days, and I sincerely hope all of you have had similar experiences. I don't know that I can fully express how meaningful this award is to me. Over the past year and a half, I've had the privilege of interacting with thousands of caring and committed individuals working every day in long-term care communities, dedicated to serving their residents, families, and colleagues, despite the terrible grief, fear, and hardships they've experienced. To me, every person who gets up each day and goes to work, every one of you who are here at this meeting, who have taken the time to share your stories and the lessons that will guide this industry into a brighter future. You all are champions of quality and heroes to me. On behalf of my colleagues at CDC, we are incredibly grateful that we were already partners with AHCA, NCAL, and the many, many other provider organizations that represent this setting before the pandemic. I don't know how much harder this experience could have been if we hadn't already been working together, developing a foundation of trust and the shared commitment to promote quality and safety that enabled us to exchange information, learn together, and take action faster. On a personal note, I have to give a shout out to all of my Georgia colleagues for their years of support and collaboration. My dear friends at AHCA for their mentorship and for taking my calls at every hour of the day and night. And my family, especially my parents and my husband, for their unwavering belief. This is an incredible honor, and I thank you from the bottom of my heart.